name is Debbie and I'm a student nurse practitioner from Touro University. I'm here to do your physical assessment.
Okay.
Okay, can I have your name?
Carolyn,
And what year is it?
2018.
Who's our president?
Trump,
And what city are you in?
Las Vegas.
And why are you here today?
A physical exam.
Okay, so she is alert and oriented ×4. She's got a good posture. She's sitting erect. She's dressed appropriately. Looking at her, I see I see equal respirations, no retractions, and her speech is clear. So first of all, I'm going to wash my hands and close the curtain for privacy. Now I'm going to start by inspecting your head and face. Looking at her skin, it's symmetric. Her facial features are symmetrical. Her skin is pink, dry, intact. I see no redness, no lesions, no bumps, no discolorations. I'm going to look at your hair. Looking at her hair, it's nice and clean, it's shiny. I see hair evenly distributed and no alopecia or pesticides. I'm going to palpate your head. Tell me if it hurts.
No, it does not.
Okay. What I'm feeling for are bumps or any abnormal lumps. I don't feel any bumps, and her head is normal cephalic. Now I'm looking at her nose. Her nose is nice and midline. Her ears are even to the outer canthus of her eye, bilaterally. Looking at her arcle and turbinate, I don't see any tags, no masses or lesions behind her ears, no drainage in the ear canals. I'm going to palpate your facial bones. Tell me if there's any pain. The frontal, temporal, zygomatic, mandible, maxilli. Any pain?
No.
No pain and with palpation. Next, I'm going to have you look up and look down. Her sclera is a china white. Her pupil is round. Her iris has color evenly distributed, and the lens is flat. Next, I'm going to look at her eyelash. Her eyelashes are symmetrical, no crustaceans, and her eyebrows are also symmetrical with even hair distribution. I'm going to have you, I'm going to pull down and look up. And her lacrimal apparatus is intact. Was there any pain?
No.
Without pain. Next, I'm going to palpate your maxillary sinus. Tell me if there's any pain.
No.
And your frontal sinus. Is any pain?
No.
No pain on her sinuses. Now I'm going to also use my pen light, and I'm going to check for perla. So look straight ahead. Her pupils are nice, equal, round and reactive to light. And follow my pen with accommodation. Her pupils are also 4 millimeters in size. Now I am going to check the cardinal fields, which will check cranial nerves 3, 4, and 6. So I'm going to have you look straight ahead and follow my finger with your eyes. And she has good equal movement with her good ocular movement, so cranial nerves 3 and 4 and 6 are intact. Now I'm going to have you do the cover-uncover test. So I'm going to have you cover your eye and then cover your eye. Cover your eye, uncover your eye. The other one, cover your eye, uncover, cover, uncover. I see no nystagmus. Next, I'm going to check your pupillary light reflex. It'll be about 30 centimeters away. I'm going to have you look at the wall. And I see positive pupillary light reflex in both eyes. Now I'm going to use the red light, and I'm going to examine for the red light reflex. I'm going to take off my glasses. And look straight ahead. And I see a positive red light reflex. And her macula is round, creamy yellow in color with distinct edges and no nicking. I'm going to do the same thing on the other eye. You see positive red light reflex with her macula round, distinct edges, no pallor, and pearly and yellow in color. Now I'm going to do the, have you cover your eye, and I'm going to cover my eye, and we're going to check your fields of vision. So tell me when you can see, looking straight ahead.
I see. 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 See.
Another eye.
See. 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 See.
Thank you. So this will check cranial nerve number 2. Now I'm going to check her ears. I'm going to change lenses. Okay. I'm going to stand on the stool. So I'm going to look in your ear. And what I see is her tympanic membrane is a pearly gray. Her ear canal is pink, no drainage, no secremum. I'm going to check her other ear. And the same. Her tympanic membrane is nice and pink. The cone is at 5 degrees in the right and 7 degrees in the left. And there's no drainage or pus and no redness noted, just a healthy pink in color. I'm going to push on your pelvis. Tell me if there's any pain.
No.
Good, no pain. Now I'm going to do the whiny Reber test. How I do this is I'm going to hit this. You're going to feel vibration on the top of your head. Tell me if it's even or if it's stronger on one side than the other.
Even.
Okay, now I'm going to do the same thing. You're going to feel vibration, but I'm going to put it behind your ear and then in front of yours. So tell me when you don't hear it anymore.
I don't hear it.
You hear it?
I don't hear it now.
Okay, other side.
I don't hear it. I don't hear it.
Okay, that's checking cranial nerve number 8. And we're going to also, I'm going to do the whisper test. Can you cover your other ear? And I'm going to whisper a couple words. Tell me what you hear.
1, 2, 3. 3, 4, 5.
So her cranial nerve 8 is intact for hearing. Now I'm going to examine your nose. Nose is symmetrical, no deviation. It's soft, skin is nice, pink and intact. I'm going to occlude your nostrils. Tell me if they're patent. Breathe. Another side. And your nostrils are nice and patent. Now I'm going to examine in your nose. What I'm seeing is no septal deviation, turbinates are pink, no drainage, and her nose passages are nice and pink. I'm going to inspect her mouth. Her lips are nice and they're soft. They have no cracking. Can you open your mouth? I'm going to look in your mouth. I see her hard and soft palate is intact. Her teeth have no dental caries. Her gums are nice and pink. I don't see any pus, no redness. I'm going to have you say ah. This will check the 10th cranial nerve. And the uvula rises midline. Also, again, her tonsils are 2+ bilaterally with no white spots, and there's no redness noted in her tonsils or her pharynx. Next, I'd like to have you lift your tongue up. Looking underneath, it's nice and pink and moist. Under her tongue is nice pink and moist without any redness, swelling, or irritation. Smile like this. Her teeth are nice and straight. Her gums are nice and pink and up against her teeth. Next, I'm going to check your fifth cranial nerve, and that's going to be with this cotton. Can you close your eyes and tell me when you hear it or feel it?
Feel it. Feel it. Feel it. Feel it. Feel it.
So her fifth cranial nerve is intact. Next, I'm going to check the fifth and seventh cranial nerve. By this, I'm going to have you close your eyes tight. Open your eyes. Squint your forehead. Raise your eyebrows. Stick out your tongue. Smile and puff out your cheeks. Thank you. Her fifth cranial nerve is intact. Next, I'm going to have you, I'm going to check her trachea. Trachea is nice and midline without deviation. Her skin is nice and pink and warm. Good turgor. No redness, no swelling noted, no masses or lumps. Now I'm going to check your lymph nodes. I'm going to start with preauricular, postauricular, occipital, mental, mandibular, supraclavicular, postauricular, postcervical, sorry, turn your head to the side, and deep clavicular, other side, and deep clavicular, and shrug your shoulders, and supraclavicular. I don't feel any masses or swelling or any lumps. Did you have any pain?
No.
Okay. Now I'm going to check cranial nerve number 1, which is the sense of smell. Can you tell me what you smell?
Mint.
Thank you. Cranial nerve number 1 is intact. Now I'm going to auscultate your carotid arteries. And I'm going to do them both. Normally I check them for a minute each, but for time I'm just checking them, and they're 2 + equal and bilateral. I'm going to use the bell, and I'm going to, so I palpated them, now I'm going to auscultate them with my bell. I'm going to check these in 3 different spots. I'm going to have you take a deep breath. Hold it. 1, 2, 3. Out. 1, 2, 3. And I don't hear any breweries. Thank you. Now I'm going to note that her neck is midline. Her shoulders are symmetrical. I'm going to have you stick out your tongue. Lift your tongue up. Lift it down. Lift it side to side. Say light, tight, dynamite.
Light, tight, dynamite.
Cranial nerve 12 is intact. Now I'm going to have you, I'm checking cranial nerve number 11. I'm going to have you raise your shoulders and put them down and lift your shoulders up against resistance. And cranial nerve number 12 is intact. I'm going to check the range of motion on your neck. We're going to start with moving your head forward, move it back, move it to the right, move it to the left, tilt it to the side, tilt it to the other side, and do a circle. I'm going to have you push and turn against my hand and my other hand. She has full range of motion with strength 5+. I'm going to have you turn around. And now we're going to check her skin on her back. Her skin is nice and pink. It's warm and dry. I see no bumps. I see no swelling, no redness. I see equal chest expansion with the AP diameter of 1 to 2. And breathe out. Equal expansion on her chest. I also am going to ask you to tilt your head forward, and I'm going to inspect your spine. So what I'm checking for is a straight spine with no tenderness, no lumps, and that's not what I'm feeling. Any pain?
No.
Okay, she has no lumps or tenderness, no heaves. Now I'm going to test tactile fremitus. I'm going to push on you and have you say 99.
99. 99, 99, 99, 99.
And it's clear with vibration, no dullness noted. Next, I'm going to check for CDA tenderness. Let me know if this hurts.
No. No.
No CDA tenderness. Now I'm going to palpate the lung fields. And her lung fields are, it's nice and no dullness, no nothing ordered. Now I'm going to also auscultate her lungs. Take a deep breath and out, all 8 fields. What I'm listening for is equal sound, any adventition sounds like rhonchi, wheezes, which I did not hear. I'm looking at her breaths, which are nice and equal and labored. Also, I am looking for any retractions, which I don't see. Next, I'm going to have you do the E phony, and on all the spots, please say E.
E, 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 E.
And with that, I hear a nice high-pitched sound with no echoing. Can you turn on? While you're here, I'm going to palpate your thyroid gland. Have you swallow? And swallow again. I feel no masses in the thyroid gland, and her thyroid rises and falls evenly. Can you turn back around? I'm going to auscultate your lung sounds in the front. And what I hear are nice, even lung sounds in all quadrants. And I see no chest retractions. I see no cyanosis. I hadn't heard lips or skin. I see no heaves. I see even calm breathing. Next, I'm going to ask you to lay down. No, wait, stay sitting up. I'm going to listen to her heart sounds. And for those, I'm going to start at the right second intercostal space, which would be the aortic. Pulmonic is the second intercostal space. Erb's point is third intercostal space. Tricuspid is fourth intercostal space, and mitral is fifth intercostal space in mid-clavicular line, which is also the point of maximal impulse, which I feel as 2 plus, where that's the where the heart beats the strongest. So now I'm going to listen, and normally you listen for a minute with the bell and the diaphragm. I'm going to start with the bell, but I'm not going to listen that long just for the video. And now the bell. And what I'm listening for are her heart sounds. I hear S1, S2, no S3, no S4, no murmurs, no clicks, no heaves. Now can you lay down? And we're going to do the same thing with her lying down. We're going to listen to all those quadrants: aortic, pulmonic, Erb's point, tricuspid, mitral, and with the bell, aortic, pulmonic, Erb's point, tricuspid, mitral, and now turn on your left side. Aortic, pulmonic, Erb's point, tricuspid, and mitral. And when I'm listening for any murmurs, any clicks, and I don't hear those, I don't hear S3, S4, and I hear S1, S2. Now I'm going to palpate for any heaves or lifts. And I don't feel any heaves or lifts. Next, I am going to look for any JVD. This is where they lie supine at a 30 to 40 degree angle. Can you turn your head to the side? What I'm looking for are any abnormal pulsations or any lifts, which I do not see. Now I'm going to move on to the abdomen. I'm gonna just pull this up for a little bit. And I'm gonna check her skin. And her skin is nice and clean. I don't see any bulging. I don't see any abnormal pulsations. I don't see any striae. I see skin color that's even and symmetrical. It's pink, no redness or any masses. So I'm going to first start by auscultating her bowel sounds. I'm going to start at the right, lower right, upper left, and lower left. So with those, you usually listen for a minute, but I'm just going to show you how I do it. Lower right, upper left, lower left. And what I'm listening for are her bowel sounds, which I hear normal active sounds in all quadrants. Now I'm going to listen with my bell, which you usually listen for a minute, but I'm only going to listen and show you where her arteries are. Aortic, renal, iliac, femoral. And what I'm listening for with the bell are any bruits or murmurs, which I don't hear. Now I'm going to percuss her liver. And I'm listening for a dullness. And her liver span is about 7 centimeters, and normal is between 6 and 12. Now I'm going to palpate the spleen. And that's going to be on the left costal margin. Any pain or tenderness?
No.
Okay, I'm going to feel. I can't feel her spleen, and now I'm going to feel for the kidney. And I can't feel the kidney, and I can't feel her right kidney, which is normal. Now I'm going to do light palpation of your stomach. Tell me if there's any pain.
No.
And doing this, I'm feeling for any masses, any tenderness, and I'm going to do the same pattern that I did on her sounds, which is, I'm going to go deeper. The lower right, upper left, lower left. Any pain?
No.
I didn't feel any masses or pain. Now I'm going to have you bend your knees, and I'm going to feel her inguinal lymph nodes. And what I'm feeling for is any masses or any tenderness there?
No.
And no tenderness noted. Okay, now I'm going to have you straighten your legs. I'm going to have you lift your right leg up and down, left leg up, left leg down. I'm going to have you bend your legs up and pull your legs out and push them in. Pull them out and push on me. Good, nice and strong. In, nice and strong. Now I want you to straighten your legs and pull them out, pull them in. And now I want you to lift up your right leg and push down on my hand. Push. And the same with the other. And push. She has strength by about a 5. Now I'm going to have you push your feet down, put your feet up, push down on my hands, push up on my hands. She has turn your feet in, turn them out. She has full range of motion of her feet, her legs, and her hips. I'm going to palpate your hips. Any pain?
No.
Any pain in your knees?
No.
Any pain in your ankles?
No.
And there's also no swelling. I'm also going to inspect the skin, which is normal and dry pink, no swelling, no edema noted. Her nails are nice. I see no ridges. Capillary refill is less than 2 seconds, and there's no sores between her teeth or between her toes or on the bottom of her feet. Now I'm going to have you sit up. I'm going to have you raise your arms up. Put your hands together. Put them behind your head. Put your arms down. Put your arms behind your back. I'm going to have you rotate your shoulders and rotate them back. I'm going to have you bend your arms, pull them up, pull them down, pull them in, pull them out, pull them in. I'm going to have you pull back, push, pull back, and she has a good rebound reflex. I'm gonna have you put your hands out, push down on my hands, and push up. Strength 5 out of 5. Now I'm gonna have you bend your wrists, pull them up, spread your fingers, put them together. She has normal movement. I'm also gonna check your radial pulse. It's 2 plus equal bilateral. I'm gonna check your dorsalis pedis, which is on top of the foot, 2 plus equal bialis, and the tibial, dorsalis tibial, which is 2 plus equal and lateral. Now I'm gonna check your capillary refill, which is less than 2 seconds, and her nails are nice and soft, no clubbing, and no ridges noted. Now I'm gonna have you take your fingers and touch your nose. Now I'm going to have you touch your fingers to your thumbs. Good. Next I'm going to have you lay down. I'm going to check the Rosing sign, which is the left lower cavity, and I'm going to press down. Any pain?
No.
I'm going to check the Murphy sign, which I hold my fingers under your liver. Any pain?
No.
Now I'm going to, these tests will check for any appendicitis. Next, I'm going to check the psoas sign. Starts at the umbilicus over about a third, and I'm going to push down. Any pain?
No.
Next, I'm also going to check the obturator sign. Can you flex your hips with the knees bent? And I'm going to push inward. Any pain?
No.
Okay. Next, I'm going to check McBurdy's point, which is what I did wrong, which is the umbilicus over above the hip and the third down. Any pain?
No.
And the psoas sign, lift your right leg up straight, and I'm going to push. Any pain?
No.
Okay, so negative for appendicitis. Now I'm going to have you sit up, and I'm going to check your reflexes. Okay, we're going to start with the brachial. And then the tibia, or and the brachioradialis, and then the patellar, 2 plus bilateral, and the posterior tibial, 2 plus equal bilateral. Next, can you lay down? I'm going to check your femoral pulse. And stretch your legs up like this. 2 plus equal and bilateral. I'm going to have you sit up again. And I'm going to check how you walk. So if you could stand down. I'm going to have you walk across the room. And I don't see any swaying. I'm going to have you walk on your heels. Check your balance. Come back on your toes. And heel to toe. Very good. I don't see any swaying or any abnormal moves. Can you sit back up? I'm going to check your stereognosis. With that, I'm going to place some objects in your hand, and you're going to identify them with your eyes closed.
Key.
Okay, other hand.
Pen.
Good. The next one I'm going to do is I'm going to check the graphesthesia, and I'm going to draw a figure in your hand.
6.
And the other one?
8.
Very good. Now I'm going to have you lay down one more time, and I'm going to check your Babinski reflex. This is usually, it's positive in a baby, but it's negative in an adult. And if it was positive, you'd see your toes fan, which your toes are not. So she has a negative Babinski. Now I'm going to have you stand up, and we're going to check your spine. Okay, I'm going to have you bend over, and I'm checking her spine. It's nice and straight. I don't see any abnormal curvature. Stand up. No lordosis or scoliosis. I'm going to hold on to your hips. I'm going to have you bend to the front, bend to the side, to the other side, and to the back. She has full range of movement in her spine. Lastly, I'm going to have you turn around, hold your hands up and out, and I'm going to check the wrong bird. And no swaying noted. Okay, you can have a seat. Any questions?
No.
Thank you very much.
Thank you.